What sets your business apart from the other contact lens specialties? And when you were opening up your practice, what are some advice that you'd give to us to open up the practice itself, starting up from scratch?
So I specialize in myopia management and dry eye as well as specialty contact lenses. But one of the things I think is, like I was telling you earlier, just be patient because it takes a while to get patients, right? So I think just kind of talking to different colleagues and also marketing what you love to do. Because when you love it, like there's not as much work that has to go in because patients and providers see that you actually are passionate about it. And so it's not like you're, oh, okay, I have to go like educate people about like, this is what I do and I'm so excited to help all these people. I'm dedicated to this. And so people feel that energy, passion, and like that you're here to help people.
Do you recommend taking a separate billing and coding class?
So billing and coding is definitely a challenge. Insurance companies are challenging to deal with, I'm not gonna lie, but it is something that, yes, you can learn. And it does require some work. A lot of people will right away just hire someone to delegate that. And usually people that you hire will kind of learn along with you. Like, what are the codes that you're using? What works? What doesn't work? And like at the beginning, if you're not buying a practice that's already running, you're kind of slow. So you can see what comes in, you can see what you're billing and what works and what doesn't work. So starting slow is actually an advantage when you're learning things because you can actually learn from mistakes a lot better and you can improve on those rather than, sometimes buying a practice and falling into years of like billing errors and like trying to deviate from that.
Do you have a specific brand of scleral lenses or ortho-Ks that you prefer?
So I really like working with Euclid Vision Group. They have visionary optics and also Euclid Emerald lenses for ortho-K. I really like working with visionary optics because I use the SMAP 3D profilometer, which allows me to get lenses that fit really, really nicely. I also do a lot of iPrint Pro, which is an impression-based lens, and I really love the results and also the service I get with Emerald lenses. I get one-on-one consulting. It really works really nicely for kids and the turnaround time is great and it's just been a very smooth experience.
What's the average turnaround time?
So scleral lenses is going to be anywhere between like 5 to 7 days, and I think orthokeratology would be more around like the 7 to 10 days. So I think it's really important when you have a patient walk in that you want to give them a smooth experience. So they come in, they fill out an intake form, they're always offered like something to drink, and then we verify their insurance, and that's important that they know what they're going to pay before they sit in the chair, before they're examined. And then you talk to them and hear if anything changes, in here based on the conversation, they're informed of those changes. And then when they walk out, there's no surprises, they know what they're getting. And a lot of the time you have to repeat things often. And that's because a lot of the time there's so much going on and there's so much information that they may not remember everything you're telling them in here. But we make sure to tell them, for example, when they're doing like scleral lenses that they have a 90-day warranty. When they're doing ortho-K that they have a 90-day warranty. A lot of patients will receive their lenses the first time and it won't be finalized. So if you explain to them that they can come back for adjustments, it's clear because you don't want people to be disappointed when they get their lenses the first time. Oh, these don't work. Why don't these work? I just paid XYZ. I just used my insurance benefits. You have to explain to them, this is not a one-time, like one shot. And if you get it in one shot, that's great, but that's not something you're promising. So it's a lot about like, under promising and over delivering, and a lot of the time if you finish sooner than what the patient thought, it's a pleasant surprise rather than why is this taking so long. So just setting expectations from the moment they walk in to before they leave, and then everything and setting up follow-ups and things like that.